Hoping they'll outgrow it, find out if your child's behavior signals something more than just a phase and what to do about it. Hi, I'm Dr. Roseann, and today we are talking about kids' behaviors because everybody always wants to talk to me about, is it normal or is it not? And will they outgrow it? Is it a phase? So we're going to dive into that and really to help you understand what are common phases that kids go through, what are some of the root causes as to why they struggle, and what you can do to better support your kid. Because, man, they send you home with a kid and they tell you how to put a car seat in, but nobody prepares you for the behavioral challenges that come along the way. And that's what this channel is all about, is teaching you how to manage your child's behavior because, it's hard and kids' nervous systems get dysregulated. So let's talk about what is typical development. Like, what are normal things that kids go through? So first of all, tantrums, meltdowns, defiance, backtalk, trouble listening, these are all normal to a point, right? And every kid goes through a need for autonomy, and it looks different with a toddler, right? We let toddlers be tyrants, and that's okay. A school-age child, a middle school child, high school, they all go through these phases, and it's often driven by that need to be autonomous. I remember the first time John Carl had like a tantrum at 9 months, right? Max always had them, right? So, that's a great example of when it is a problem. But and it was always for him about when he wanted to do something on his own. He was really independent. His first, two-word sentence was "me do." He just liked to do things on his own. And it's a great thing, but I would find he wasn't even talking, and I would find him on top of the counter, getting his own cups and things like that. So these are normal phases when it comes to kids wanting to be autonomous, and there's going to be pushback. You're growing, they're growing. So when is it a sign that there's a problem? These meltdowns, these upsets, the difficulties, transitioning or those kinds of things. Number one, you are doing good things. You are being patient. You are trying to teach them. You're setting boundaries. You're leading by example. You're not screaming 90% of the time. And it's still persisting, right? So maybe you have other kids. This is what happens a lot with me and the families that come to see me. And if you're interested in working with us in any capacity, whether it's virtually in our dysregulation solution program or one-to-one in our brain behavior reset program, or you just want more information about how to help your child, you can go to drroseann.com/help, and it's going to match you to the right solution to where you're at. But parents come to me and, they have another kid and they're like, oh, I didn't realize a kid could be regulated. Like, and I could just say a few things and all of a sudden they learned. And I didn't know that my older child really had a problem until the second one came along, right? Or they're like, listen, I got 3 other kids and I'm realizing this problem is persisting. So I need to know if something's going on with my kid. And that's where we do a brain map. And, we really look at what's under the hood and we don't guess, we really get down to it. Or they'll say to me, I need to do something different as a parent because it's not working with this kid, which is, can be both cases, right? We don't always have to have a clinical issue. So number one, it's persisting despite, consistent action by you, right? And I'm going to, you now have that, take that with a grain of salt, right? Like we don't know what we're doing. We're given this baby and we don't know what we're doing. Right. And we learn from our parents how to parent, and, some of that's great. And sometimes it just doesn't work with what's going on with your kid in this generation, this issue, whatever's going on. We have to take the best of what they taught us and then really use science driven methods. And that's what we're talking about. So if your child's problem, right? So we have overreactive behaviors, right? Hopefully you just listened to the episodes on the nervous system. So we have overstimulated, overreactive nervous system. The nervous system, you're seeing big reactions, meltdowns, yelling, irritations, you know, upset over minor things, hyperactivity, impulsivity. On the inattentive side, right, on the side where we have understimulated behaviors, a nervous system that is working slower, right, and not reacting in the same way, we're going to see things like inattentiveness, problems listening, maybe anxiety, shutdown, right? In any of those circumstances, if the intensity, frequency, and duration is a lot, then we've got a problem, right? And again, it could be there's an organic problem with your child, right? It could be that they have, inherited issues. I don't find that the most common reason that kids have problems. I really don't. We have genetic mutations. We have things like poor nutrients. We have infections and toxins creating brain inflammation. There's a lot of reasons things could be going on. So the intensity, frequency, and duration is a problem. And always 100% of the time, if you have a sudden onset of a problem, you got yourself a major problem. Something is going on. So it could be a major situational stressor, right? Could be something really bad, like, bullying or victimization or something, going on. A major life stressor, the loss of a grandparent, divorce, death, any of those kind of things. Or it could be infections and toxins. We could have a case of pans and pandas where an infection or infectious or toxin trigger creates a misdirected immune response and can bring on a sudden onset of psychiatric, neuropsychiatric issues, cognitive, neurocognitive issues. We need to really pay attention when it's a sudden onset. Um, you know, Many of my parents do seek help when there's a sudden onset and are often poo-pooed they're gaslighted. That's my way of saying that. So really clear, okay? Developmental issues happen. Kids move through them. They don't get stuck in them. You do your best with parenting. Maybe you've had other kids and you're like, that worked before. But when they're persisting, you really have to look at next step. What are those root causes, right? So we talked about neuroinflammation. We talked about toxins. It could be trauma, stress, uh, all different type of life changes, too much device time. I mean, the amount of time kids are on devices is crazy. It's like 7.25 hours, I think, for teenagers, but younger kids are even spending more, 10.5 hours a day. And no, I don't know if that includes school time. That's just overall. So we have to look at potential root causes and then what can you do about it at home? Obviously, sudden onset, get help right away. Find somebody who will guide you to the right direction. Your pediatrician doesn't guide you, go past them. Find somebody else, okay? And keep searching. This is where people ask questions in my Facebook group. And you go to drroseann.com/group. There's a free Facebook group in there. You find help in any way, shape, in a safe place until you get the answer. Because truly, that is the most regretted problem. That parents come to me, they just regret not getting the right help sooner, and they do keep searching, but sometimes it just goes on over years, and actually most of the time it goes on over years, and then it becomes much more compounded and you have a lot of layers, and that layers mean a lot of psychological issues and trauma from not finding the right help for everybody, and that's never good. So number one, what can we do? That first step at home, right? So we want to look at expectations. So are your expectations right developmentally and for your child? Don't think about their age, think about their developmental level. So if you have a child who maybe has autism or ADHD or a learning problem, developmentally, they may be behind. And that's where they're at. So how can we support them? We can't always say, oh my gosh, they have to exactly be on the same track exactly right there where the other kids are. We're not talking IEP. We're talking in life, right? So they're missing some of those basic skills, right? And your expectation is too high for them. So how can I adjust my expectations? Because yes, you're going to adjust your expectations, but give them the right support, right? Because they'll get there. They're just going to get there in their own time. And I think some of that is just parental pressure from other parents. I mean, I can't believe the stupid things parents say to me, friends and family about Max and letting him, work on his own time, finishing high school and things like that. People say stupid, educated people say stupid things to me. And then I have like a very saucy response. I just stop people in their tracks when they say that to me, and then they just shut their mouths. So I try to be nice and try to explain. Now I just don't even bother. And you don't have an obligation to anybody but your own family. Words of Philomena on her. Today is her 2-year anniversary of her passing. So just remember you have an obligation to your child and your family and nobody else. You don't have to say anything. You don't even have to be saucy if you don't feel like it. I am. So what are those expectations? And then you want to think about routine, structure, and boundaries. Like what are your explanations? Like what are you doing to support your child with that learning issue? Because whether it's a tantrum or it's a focus problem, there are things that are not clear for your child and they need more repetition. They need more structure, right? So your child is having big emotional meltdowns. They do not know what to do. Telling them to calm down is meaningless. That's like the worst thing you could ever say to somebody, right? But giving them sensory support, right? Maybe cueing them on that, right? And then you always want to do your dissection, your debrief dissection after, like, wow, that was really hard for you, but I noticed this time um you punched your pillow and that seemed to really work for you, and your teenager's like, yeah, it did. Okay. Well, that seems like that's a regular strategy that's really helpful. What else do you think maybe could be of help? And they might say, I don't know. And then you want to give them solutions and work and practice on that. And you always want to reinforce, reinforce, and reinforce. It's important to give your kids, right? That first step is what is your expectations? If you have a kid who's neurodivergent, they're wired uniquely, it doesn't mean we lower the bar. We change our developmental expectations to allow time for them to learn. Okay. And that is not an easy thing. And you probably need professional guidance, right? You can go, as we talked about, you can go in our dysregulation solution. But when kids are struggling, right, and they're stuck, you have to adjust what you are doing as parents. We don't rush to clinically label them, even though that may be part of what's going on. But there is so much a parent can do. And when we start thinking about the nervous system, how can we regulate it? How can we regulate ourselves? And then we layer on the learning. Boy, it gets absorbed. No learning can occur with a dysregulated nervous system. Calm the brain, everything else follows. I hope that sticks with you today.